when you have an enormous, unprecedented event, the department that is in the forefront of responding to it, of course, is going to do its best to rise to that challenge, and that's what the DHSC did. Did everything go right? Of course it didn't, and you wouldn't expect it to. It is natural for the centre, the Cabinet Office, to be sceptical of departments. That's what I was the Cabinet Office Minister, as you've noted. The culture of the Cabinet Office is to be sceptical of the operation of departments, partly to hold them to account. I think that the toxic culture that you've seen at the centre of government, that's been subject of much discussion, was unhelpful in assuming that when anything was difficult or a challenge, therefore there was somehow fault and blame. That is a part of the toxic culture that we've seen, and some of these exhibits that you've just shown demonstrate a lack of generosity or empathy in understanding the difficulty of rising to such a big challenge.
In the diaries, so-called, and in your statement, you make plain that the remit of the Department of Health and Social Care was a vast one. It had, of course, all its usual business. It was the lead government department in response to this national public health crisis, and the obligations upon it were, to use your words, vast and fast-paced.
Yes.
In Module 1, you accepted in the course of your evidence under oath that there had been a serious and significant inadequacy of preparation within the DHSE for a pandemic health emergency. May the inquiry take from that acceptance that on the cusp of the pandemic in January 2020, the absence of preparation had serious, significant consequences in terms of the DHSE's ability to be able to respond?
Well, of course, as Secretary of State for Health and Social Care, I was responsible not just for the department, but ministerially responsible for the wider health family as well, the agencies, of course, the biggest being the NHS itself, and Public Health England and others. And it is absolutely true, as I set out in my evidence in Module 1, that the plans that we had were not adequate. As we discussed in Module 1, that was, I think, on two bases. The first is in practical terms. For instance, the UK didn't have a significant testing capability, and in terms of the wrong doctrine, which was that all the planning based on the 2011 pandemic flu plan onwards was based on the assumption that we'd be dealing with the consequences of a pandemic rather than trying to suppress a pandemic.
Does it follow from the absence of preparation and perhaps the way in which, in terms of planning, the department, as well as the rest of government, may be said to have been pointing in the wrong direction, that when the DHSE and yourself were required to address the crisis and the breaking of the crisis in January and February, it became apparent that in terms of the structure, the personnel, the resourcing, the money, as well as the absence of plans to deal with the coronavirus, that you were in very real difficulties.
Well, a couple of points on that. The first is I take issue with absence of a plan. There wasn't an absence of a plan, there were plans. I've critiqued the plans. I've said that they weren't adequate, but there were plans in place. There was the 2011 pandemic plan. There'd been the Cygnus exercise under Jeremy Hunt's position as Secretary of State. So there were plans. There were areas in which the early response was very strong. PHE got a diagnostic test together within a matter of days. The early surveillance, essentially led by Professor Van Tam, as he's given evidence, was very good, and our role, the UK's role internationally, strong in the first a few weeks. So there were plans, but the plans were inadequate in ways that we discussed in Module 1. With respect directly to the impact of that on the department, of course, when a pandemic strikes, even if you had the very best plans, those responsible for responding would have to strengthen the operation, would have to tool up. And in the early days, we expanded the department very significantly, and we ultimately brought in army personnel, for instance, lots more clinical personnel, others, and we took people off non-pandemic related work and put them onto pandemic related work. All of these things were in response to the pandemic. They would have been needed whether we had, even if we had the perfect plan, even if we learn all the lessons, next time there is a pandemic, and there will be another one, that of course the Department for Health will have to shift to respond to those challenges.
You say there were plans, and you're astute to make the point that there was a plan, the 2011 pandemic flu strategy. But your statement itself says, and I quote it, "There was no book or report to pull off a shelf to tell us how to handle a pandemic."
Yes.
So, of course, as with responding to any crisis or emergency faced by government, the absence of a book or report to tell you how to do it is going to have an impact on your practical efficiency, on your ability to respond. That's obvious, isn't it?
Yes. This was the first major pandemic in living memory. There wasn't anybody who'd responded to it. None of my living predecessors as Secretary of State had to deal with something on this scale.
Indeed. You are aware, of course, from the witness statement of Mark Sedwill, now Lord Sedwill, the Cabinet Secretary, that in a report to the Prime Minister in the summer of 2020, he said the DHSC was neither structured nor resourced for a public health crisis of this magnitude. Granted, it's a very broad observation, and it doesn't, of course, deal with the institutional links between the DHSC and the NHS and Public Health England, or the scientific advisory structure, or, of course, the possibility that there would be movements in personnel and a ramping up in funding for the department. But in a broad sense, that is a correct proposition, is it not? Structurally and in terms of resourcing, when the crisis broke, the DHSC was under par.
Well, he didn't use the words under par. They're your words. And I would reject that because the senior personnel in DHSC were absolutely superb and rose to the challenge. But it's blazingly obvious that when a pandemic strikes, the health department is going to have more to do. And so I regard that comment as very straightforward.
All right. Could we have 273901, page 78? This is an extract from Sir Patrick Valance's diaries, dated the 3rd of June 2020. Quad call exposed the massive internal operational mess inside DHSC and PHE. Could we have page 587? Also, clear lack of grip in DHSC. This is in July. Very good at analysis, no grip on actions. Sedwill. Page 594. Email from within DHSC describes it as ungovernable and a web of competing parts. And I'll summarise. There are other diary entries in Sir Patrick Valance's evening notes where he says it's clear that once again DHSC has done nothing. People lobbing in points, no clear operational accountability, and so on. Regardless of what reasonable mitigation might be offered, and there is obviously mitigation which may be offered, senior officials in government continue to express concern over a number of months. Lord Sedwill, Sir Patrick Vallance and others, Helen McNamara, about the state of the DHSC, correct?
Well, I don't know whether these parts of Sir Patrick's diaries were contemporaneous, because I know that some was written after the event.
Well, can I just pause you there with respect? These were evening notes made certainly more contemporaneously than your diary, Pandemic Diaries book. The vast majority were written on the day or the day after. Only some, it is apparent, were written later.
Yeah, so as I say, we don't know whether these are contemporaneous, but that is by the by. The point here, I think, in response, is that when you have an enormous, unprecedented event, the department that is in the forefront of responding to it, of course, is going to do its best to rise to that challenge, and that's what the DHSC did. Did everything go right? Of course it didn't, and you wouldn't expect it to. It is natural for the centre, the Cabinet Office, to be sceptical of departments. That's what I was the Cabinet Office Minister, as you've noted. The culture of the Cabinet Office is to be sceptical of the operation of departments, partly to hold them to account. I think that the toxic culture that you've seen at the centre of government, that's been subject of much discussion, was unhelpful in assuming that when anything was difficult or a challenge, therefore there was somehow fault and blame. That is a part of the toxic culture that we've seen, and some of these exhibits that you've just shown demonstrate a lack of generosity or empathy in understanding the difficulty of rising to such a big challenge. So, did the DHSC need to expand and grow? Of course. Did it get everything right? No, of course not. There were, no doubt, we'll go into individual challenges. But did it rise to the challenge overall of responding to the biggest public health crisis in a century? I think it did. If you look at the successes, for instance, on the growth of testing once the department took that over, getting the vaccine rollout up and running, various other projects. So, you know, we can go through all of the detail. In terms of lessons learned, what is crucial is that any department in future is ready to go. And I'll make one final point, if I may, which is relevant to your question. At the start of the pandemic, the department, including me, was trying to wake up Whitehall to this threat. And early on, the department ended up doing things which really aren't for a health department. But we were doing them because nobody else was.
Could you just give us
I'll give you one example. Shielding the Vulnerable is a programme that eventually was run very, very well by Chris Townsend, who was brought in from outside, and MHCLG departmentally. It was about how to get groceries to people, how to make sure that people got support, including from volunteers, how to make sure we looked after those who were the most vulnerable. That is clearly a cross-government effort and rightly led from a department that isn't the health department. But it was, I had to commission the work to get that going from the health department. Similarly, the view over whether or not to close schools ended up, and the NPIs ended up within the health department early on. Now that was taken back to the CTF, back into the Cabinet Office, and rightly so. So the department, yes, had a huge amount to do, but I would argue that because the rest of Whitehall was slow getting going, we had to get up there and do it. And if that led to criticisms from those in the centre of government, then, you know, frankly, I'd far rather that we did step up and take that responsibility, even though it brought us flack later and evidently flack at the time that I wasn't aware of, because these issues were never raised with me personally.
Scepticism, is that a reference to, and you know very well that we're coming to this a little later, the notion that individuals in central government were critical of your department because they had taken again you, they were tarring your department with the same brush as they were you, that there was a campaign, if you like, of spite and aggression against you and your department. Is that what you're suggesting by the notion that there was scepticism towards the DHSE?
Well, there is healthy scepticism of the centre of government, of departments, in which they challenge, hold to account, and generally try to keep departments moving forward. You know, as a Cabinet Office Minister, one of my roles was to make sure departments were delivering on what they'd said that they would deliver. We have seen from the emails that I wasn't, and the messages I wasn't aware of at the time, that clearly flipped over into an unhealthy, toxic culture at the centre, where anything that went wrong was seen as an almost intentional failure. And worse, that amongst some people, misinformation about what the department was delivering was spread, including to the Prime Minister and at the very highest levels. So a healthy culture involves challenge and scepticism. An unhealthy, toxic culture involves a failure properly to engage and instead throwing of false allegations and extremely unpleasant language. What you'll notice when you go through all of the documents is you just didn't have that within the health family. I tried to lead a positive culture, a can-do culture, where if there was a problem, the question that was raised in the department was, how do we fix this? Now, that didn't happen all of the time. Of course, there were moments of frustration, but that was my overall attitude in this areas I led. And you can see, unfortunately, that we rubbed up against this deep unpleasantness at the centre.